How does MRI diagnose renal cell carcinoma? Imagine a tool that lets doctors see inside the body without surgery or cutting. That's what magnetic resonance imaging, or MRI, does for diagnosing kidney tumors like renal cell carcinoma. MRI creates detailed pictures of the kidneys by using powerful magnets and radio waves. It helps doctors understand the size, location, and nature of a tumor, which is vital for planning treatment. When an MRI scans the kidneys, it uses different imaging techniques called sequences. The main ones are T1-weighted and T2-weighted images. T1 images show how tissues look based on their fat and water content. Tumors often appear mixed or heterogeneous on T1 images because they can contain areas of dead tissue, bleeding, or solid tumor parts. T2 images are great for highlighting differences in tissue water content. Clear cell renal cell carcinoma usually appears bright or high in signal, making it stand out. Papillary types tend to look darker or low in signal, helping radiologists guess the tumor type. Sometimes, tumors contain fat inside, especially in clear cell types. When doctors use special imaging called chemical shift imaging, they look for a signal drop caused by fat, which helps confirm the diagnosis. Contrast agents are also used during MRI scans. These are substances like gadolinium that make blood vessels and tissues more visible. When contrast is injected, kidney tumors often show rapid enhancement in the early arterial phase, then gradually wash out. Clear cell tumors tend to enhance strongly and unevenly, while papillary tumors enhance more slowly and less intensely. This pattern helps distinguish cancer from benign cysts, which do not enhance at all. Another important technique is diffusion-weighted imaging, or DWI. This measures how water molecules move within tissues. Tumors tend to restrict water movement because of their high cell density. On DWI images, these areas appear bright. Papillary renal cell carcinoma often shows more restriction than clear cell types, providing clues about the tumor's nature. MRI can also reveal a thin, dark rim called a pseudocapsule around some tumors. This capsule helps define the tumor's edges and is often seen in less aggressive, low-grade cancers. Recognizing the pseudocapsule is useful for surgeons planning to remove the tumor, as it shows where the tumor ends and normal tissue begins. Detecting whether the tumor has spread into nearby blood vessels is another key role of MRI. It can identify tumor extension into the renal vein or the large vein called the inferior vena cava. Sometimes, the tumor forms a clot that fills the vein, called a tumor thrombus. MRI can tell if this clot is made of tumor tissue or just a blood clot, which is crucial for staging and treatment decisions. MRI also helps differentiate renal cell carcinoma from other kidney masses like oncocytomas or angiomyolipomas. These benign tumors have different signals and enhancement patterns. For example, angiomyolipomas often contain fat, which appears bright on MRI, helping distinguish them from cancer. However, sometimes the features overlap, and a biopsy might be needed for certainty. Compared to other imaging methods like computed tomography, MRI offers superior soft tissue contrast without exposing patients to ionizing radiation. It is especially helpful for patients who cannot tolerate iodine-based contrast used in CORT scans or for better characterizing cystic lesions. But it's important to remember that MRI contrast agents can pose risks for people with severe kidney problems, so doctors carefully weigh the benefits and risks. In summary, MRI diagnoses renal cell carcinoma by combining multiple imaging techniques to analyze the tumor's appearance, composition, blood supply, and spread. This comprehensive approach helps doctors detect, classify, and stage kidney tumors accurately. It guides treatment planning and supports kidney health management. Always remember, a healthcare professional's interpretation is essential, and individual cases may vary. If you have concerns about kidney health or tumors, consult your doctor for personalized advice and care.